So hi, I am Professor Asif. I am presently Chairman Department of Cardiology, Jain Medical College, Aligarh. So today I want to discuss in brief about the issue of heart disease, which is known as coronary artery disease, and why there is a need to discuss it. Because this is a leading cause of mortality and morbidity in India and South Asian countries. It is top three causes, and if we go in further subset, it is number one killer after road accidents. So this public awareness is very important, as you are aware that there are so many cases where a person unexpectedly collapses and he's clueless about his health status, and then there's a great need for public awareness regarding the knowledge of coronary artery disease. This involves the complex pattern of patient psychology, impact on the family, socio-economic burden, long-term morbidity, repeated admission in hospital, and ability to work, especially if the person is young and person whole family is dependent on him financially, and person dies suddenly. You can just imagine, beyond your imagination, what family has to be. And everyone must be aware about heart attack in the family or extended family or friends relative or sudden death of any family member or friend or any celebrity, or you get that from news or media, and everyone is shocked that what can happen to such apparently healthy person, why he died suddenly, and even cardiologists have died in the gym, and what happened and what is this mystery. It is just like roaming with cobra in your pocket if you are totally unaware that you are carrying the substrate for heart disease. So there are so many myths in the society related to the heart disease, coronary artery disease, that we think that the females don't suffer from coronary artery disease as much as men. But this is myth. Reality is that CAD is rising in females also, and obviously there is a hormonal protection pre-menopausal. But after female attain menopause, after the age of 55 years, post-menopausal, they catch up. Their path accelerates and they catch up with the counterpart male, and becomes CAD, coronary artery disease becomes as equivalent as a male counterpart. It may be much more difficult to treat coronary artery disease and heart attack in elderly females, and this is more challenging. And don't forget that females have to bear the bias which is in the society regarding their gender and regarding the financial focus which is on the male members of the society. Another myth is that is young don't develop CAD commonly, and it is a million disease of elderly. Now in today's scenario, especially in this part of the world, it's totally a myth, because young, premature CAD, before the aging start, that even that our cutoff point is age of 45 years, our 20 to 25% of admissions are those persons who are below 45 years of age. Imagine 1/4, and we come to below 40 years, it is around 40. That is around 20%. That is malignant CAD. It is as malignant as any cancer, or it can be much more than that. So young are also suffering, and young are having a very malignant pattern of coronary angiography, and with little choice at how to go ahead. Then another myth is the vegetarian don't develop CAD as commonly as non-veg person who are a non-veg diet. This is totally distant from reality, because vegetarians are also equally prone for heart attack and coronary artery disease as compared to non-veg. There is no difference, because answer lies more with the type of oil we are using and what are our cooking practices and fried foods, rather than going on the particular type of the food. The answer is more related to how we make our food and which oil and how much oil we are using. So this obliterates the difference between vegetarian versus non-vegetarian. Another myth is that is mainly disease of urban areas, metro cities. To some degree it is correct, but rural population also now showing rising incidence of CAD. And if urban is showing 4 to 6 times rise, rural are showing 2 to 4 times rise in the incidence of CAD. So it is not as if the rural people don't suffer from CAD. There also incidence is rising. Another myth is that CAD is benign in young as compared to adult. No, it is not at all benign. It can be very malignant and very difficult to treat. Or CAD is only a disease of obese person, overweight person. Totally wrong, because even in young person, thin built person, malnourished person, they have high incidence of coronary artery disease. Which those who are having BMI less than 18 or even poorer 16, they are also prone to develop heart attack when we compare with patient with very high BMI of more than 35. So on the other side of the spectrum, it is a disease of very poor patient and those who are thin build or those who are malnourished. So practically it is a disease that is, that the heart supplies blood to the whole of the body, and heart is itself dependent on three arteries for its own nutrition, oxygen supply and oxygen. And whenever the lumen is choked with the cholesterol and platelet and practically we can say that is all that cholesterol and fibrin which occludes the lumen. So there is a mismatch between supply and demand. And as common sense says, whenever there is a mismatch, heart starts shouting for help. And this shout is mainly in the form of chest pain, which is angina. And this is a warning symptom which can precipitate in the form of heart attack, which is an emergency. So we can see the rising incidence is there, and because we are going to be diabetic capital soon, you can just multiply and see that is how the graph is going upward as far as the number of the cases, incidences, prevalence of heart attack and various spectrum of coronary artery disease are concerned. 3 or 4 main culprits which are well known in Western literature, here also they are top 3 are, I will say, diabetes, smoking and hypertension. Hypertension is very prevalent here, and untreated hypertension is very common, smoking and diabetes. Especially if it is uncontrolled, any type of smoking is equally dangerous, especially any form of tobacco consumption predispose the person to heart attacks. Then non-modifiable factors, one is genetics. We can't choose our family, because if the family predisposition is there, family members are predisposed to CAD and there are many members are diabetic, hypertensive, you may be having bad genes. Bad genes, I mean, in a way which are predisposed towards cholesterol deposition and which pushes the person towards heart attack. But what we can do is we can change our lifestyle and we can modify, we can control our environmental factor, which are acquired factor. So these are non-modifiable factors apart from age, gender, hereditary, family history, ethnicity and race. And modifiable, definitely there are blood pressure, obesity, lipid profile, tobacco use, diabetes, physical inactivity and unhealthy diet. And socioeconomic status, mental health, drug addiction, then inflammatory markers, infections, all these are, there are intrinsic milieu of the system which pushes the person towards clot formation, which are the novel risk factors. One thing is regarding smoking. For a young patient, I want to just highlight this fact that electronic smoking, which came with so much glamour few years ago, it is shown to be also not harmless. It is harmful. It can be equally harmful as compared to traditional smoking, where we burn the cigarette or bidi. Here it is battery operated. It can be totally harmful, and along with added risk of heavy metal deposition in lungs, which can be carcinogenic. So because e-smoking, electronic smoking lures especially young person as a fashion statement, and they are tempted to adopt this unhealthy lifestyle of electronic smoking, which as an entry easy pathway, because then they try to smoke in a traditional way and they end up smoking electronic and as well as traditional style, and both are very dangerous. And electronic is now all those advantages which were mentioned have been withdrawn, and it is considered as bad as traditional smoking. So there are, I don't think I need to discuss the socio-economic determinants of health. There's various factors which determine what type of lipid particles and what are the inflammatory markers which we are carrying in the body. And then, but doesn't mean that we should not stop smoking. We should stop as soon as we are aware, and because advantages built up over a period of 5 to 10 years when we stop smoking. That for immediate, and it has a legacy effect. We can leave the benefit if we stop smoking as early as possible, whenever person can be sensitized to stop the smoking. Then I will comment on few points about hypertension, because it is most common in Indian population and most of us are unaware of our blood pressure status. No one checks blood pressure. It is only accidental or rarely when we are developing some complication and doctor tells you that you are hypertensive. It is very rare, even in educated person, that they want to see what is the blood pressure status. And if they are there are so many myths, dawa ki aadat pad jayegi, you don't want to take, and then they adapt their own regime, alternate day, once weekly, without doctor's advice, and then it is hardly any use. It is purposeless, or it can lead to paradoxical rise of blood pressure. And even those who are taking blood treatment, 50% are on treatment, and out of these 50%, only 50% are on adequate treatment. So it ends up only 12.5% of hypertensive, they are on proper medicine and they are on proper follow-up, 12.5%. You can imagine that 87.5% they are not properly treated or not at all treated for hypertension, which pushes the person towards CAD. Then lipid profile, I will tell you. There are many of the genetic factor, then what type of oil which you are using, and our cooking oil practices. We always blame Western food, but our Indian foods are no far better. Paratha, burger, chola bhatura, and the way we cook even our homes, that we use the oil, and then remaining oil, leftover oil is accumulated in a container and it is cooled, and it is reheated next day or in the next meal, and it is reused. This leads to the formation of trans fatty acids in the oil. And trans fatty acids, they are highly atherogenic. I mean that they pushes towards the clot formation and cholesterol formation and chokes the arteries. And even 1 to 3% of the trans saturated fatty acid, they are very harmful, and they pushes towards heart attack and high lipid profile level. So this practice is rampant even in those persons who can afford, those people and want to imagine or lower middle class and lower classes. Rather than being obsessed with the type of oil, quantity is more important. Although there are good oils also, olive oil, this is soya bean oil, rice bran oil, but if we can't afford because they are costly oil, even mustard oil can do, groundnut oil can do, but the practical advantage is we can change one type of oil, then we can change another type of oil, because deficiency of fatty acid in one type of oil can be compensated when you change the type of oil. So quality and quantity. Quantity is more important than being obsessed with particular type of oil and not able to afford it. Then diabetes, I will again say that it is controlled or uncontrolled. Uncontrolled is disastrous, because there is no guarantee in a patient who is uncontrolled diabetes. Patient can have accelerated pathway for choking the arteries, and it can precipitate the heart attack. Obesity, there is one another important risk factor which has been identified recently in last 1 to 2 decades, is obstructive sleep apnea. Those patients who cannot sleep properly, they snore in the night, and they fight with themselves for oxygen level, and they feel sleepy all the day. So this is not limited to only improper sleep and being fatigued. This system pushes the whole environment towards atherogenesis and high blood pressure, high sugar, lipids, and clot formation, pushes to a heart attack and a stroke. So this should be identified in any obese patient who is snoring and who is extremely fatigued next morning, because this can be easily treated. Then stress, depression, the stress to achieve the target by the end of month, job insecurity, unemployment, and then psychological stress. Don't think that young patient don't suffer. The young patient, the maximum brunt of anxiety. And one thing is, because of this hi-fi life and job insecurity, it's very difficult to meet the targets. Then depression. If one partner dies and then it is a depression, loneliness, and another partner is living alone, he is totally predisposed towards depression and CAD. Lack of physical activity. Then lack of exercise. We are all sedentary. Ideally, we should be walking around 10,000 steps per day, especially younger people, and per age modification it can come to 50-60 ke baad it is 8,000 or 6,000, but 10,000 for young healthy person, and they will be surprised to know that how less they are walking. If they use their Fitbit and they count their steps at the end of the day, it will be hardly 3,000 or 4,000, most of them, I'm sure. So lack of exercise. Then another peculiar subset is women and heart disease. I already discussed. This is very difficult, and obviously we should admit that is a less focus has been on the female gender as compared to male gender as far as CAD problem is concerned. And there's so many atypicalities which are not shared with male genders. And then one important another subset which I want to focus is young CAD, because it required a lot of research. We are dependent on Western literature, and there's so many different scenarios in Indian population. Different risk factors are there which need to be studied in detail, and we should have our own guidelines regarding lipid control, and we should have more sensitized to identify our problem which are prevalent in this part of India. So symptoms mainly they are chest pain on walking, shortness of breath. These two are more symptoms which should alert the person whether he is having extreme fatigue. as per his baseline activity. We should alert the person to get investigated for heart disease. So this is the heart coronary artery disease. One thing is angina, other is shortness of breath or swelling over body, extreme fatigue. So what we can do? You say, sir, I have listened, and what we should do? We should be aware about ourselves as early as possible. There is no age limit. You should be knowing about your blood pressure, about your basic tests, your blood sugar, your lipid level especially. And if there is any doubt, you should also consult the doctor, and you can, if there are symptoms, you should always be under supervision, get ECG, or if this is indicated, you should go for further tests, stress tests, or that is exercise tests. These are the basic tests, and there is a flow chart as per the medical supervision or expert advice. So these are the basic things. पेशेंट से कह रहे हैं तो कुछ भी नहीं था, मुझे तो कुछ भी नहीं था, ये क्या हो गया अचानक. Point is, everything was there in your system. A substrate was there. You were totally unaware unless it complicated. It takes only one step to complicate the matters, but everything was there. Nothing happens in really suddenly. Nothing is sudden. Then there is a query on too much of exercise. Exercise, I want to just say that a healthy lifestyle, proper oil, at least 45 minutes of exercise per day, at least 6 times per week, which is cardio type of exercise, and which we are able to achieve our target heart rate, 85% of target heart rate. Target heart rate is 220 minus age in years. If you are 40 years of age, 220 minus 40 is 180, and 85% of 180. This much you should achieve during your exercise schedule by doing treadmill or your brisk walking. This is safe for cardiac point of view, and at least 6 times per. This includes cycling, swimming, or this includes brisk walking or treadmill. Then you should get your basic investigation done, and you should get treated as per your advice, and try to decrease your anxiety and shape and less connectivity with WhatsApp and electronic gadgets. Be more realistic and be more comfortable with your company, because this plays with your health, and this is also very important, that the mental aspect, which also pushes the person towards unhealthy lifestyle. So my message is that we should be very clear about our status. What is our blood pressure? Which family do we belong to? And what are our blood sugar? And how much exercise we are doing? What is our diet? How much calories we are consuming? What type of food we are eating? Whether it is healthy or unhealthy, which oil we are using? And enjoy life. Be relaxed. Don't be very over ambitious. Don't try to be perfect all the time. Little bit imperfect is better. You should be compliant with your failures, and you should be aware about this condition. Read and discuss with us, and there is a need for more projects, more studies, and regular camps in the public, so that public is aware about all those factors, risk factors pushes the person towards heart attack. Thank you.